Welcome back to Night Shift with Justin S. King, how to transform your life one night at a time. Tonight, we are talking about sleep position and what actually matters. Doesn't matter which side you sleep on. And the answer is yes. The strongest reason is reflux. If you deal with heartburn or acid coming up at night, left side sleeping is usually better. Right side sleeping tends to make reflux worse, likely because of how the stomach and esophagus are positioned. That's one of the clearest side-specific findings that I've been able to locate. Next up, if we're talking about snoring and sleep apnea, or if your breathing gets worse at night, the biggest problem is often sleeping on your back. Back sleeping can make the airway collapse more easily. Side sleeping usually helps keep the airway more open, which is why side sleeping is commonly recommended for positional sleep apnea. What about back pain? There's not one universal answer for this one. However, some people feel that back sleeping is excellent, especially with a pillow under the knee, and that can help support the natural curve of the lower back. This is my chiropractor's recommendation. And for others, side sleeping works well, especially with a pillow between the knees. And considering back sleeping, I saw something interesting today. Someone mentioned that it's more difficult to sleep on your back because you're in a more vulnerable position. And this is sort of an ancient problem. If you look at animals, none of them sleep on their backs. But I wasn't able to find any supporting evidence that sleeping on your back makes you feel more vulnerable or elevates your heart rate. But the best question is, what position makes you wake up with the least amount of pain, the best breathing, and helps you sleep through the night? There is one other issue to consider before we do that, and that is your face. A lot of estheticians will recommend that you sleep on your back because back sleeping puts the least amount of pressure on your face. Side sleeping and stomach sleep compress the skin more. That is where the idea of sleep wrinkles comes from. I know sometimes when I've slept on my side, I'll wake up with indentations on my forehead. However, science does not clearly support that a lot of wrinkles and aging are caused by side sleeping. They do suggest that it may contribute to some facial lines. And then there's one other strange claim that I remember hearing when I was younger, and that is that if you sleep on one side, it helps your creativity. And if you sleep on your other side, it can make you more analytical. And there is a real phenomenon called the nasal cycle, where one nostril is usually more open than the other, and body position can influence that. There's also some research on unilateral nostril breathing and brain activity. So that is where this idea probably came from. But this is not the same as proving that one side will make you more creative or the other side will make you more analytical if you sleep on that side. So the simple takeaway for this episode is this: left side is the best for reflux. Side sleeping is usually better for snoring and positional apnea than back sleeping. Back sleeping puts the least pressure on the face and can work well with some people with back pain or those trying to follow their chiropractor's recommendation. And the whole right side versus left side breathing idea is interesting, but not strongly supportive by any evidence. So in the end, choose the position that best solves the problem that you have and stick with it. That's it for tonight's episode of Night Shift. My name is Justin S. King, and I help entrepreneurs find peace tonight, tomorrow, and for the rest of their lives through sleep optimization, emotion regulation, and discovering their purpose. Good night.